Okay, let's look at question number 1. Photograph show two type of method. Okay, method M and method N. Okay, method M, method N. So what is this? This is probably what type of medical approach? Okay, so M is if you see the notes, is a complementary medicine. And another one is modern medicine. Okay, another one is traditional medicine. So you can see the method, both is good. See, depending on how you use it. Give one health problem that can be treated by using M. What are the problems that can be treated? So this is a complementary medicine using acupuncture. So maybe usually for, what do you think? I think probably for blood circulation. So I just say here, blood circulation. Let the blood flow better. That's why they poke, right? They poke their blood, so that, I don't know because I'm not a doctor, but somehow it's say that when you put the poke, it will actually help the blood to flow better. I don't know lah. Maybe they poke already, then got the hole for the blood to move faster. Is it? I don't know. But usually it relate to the blood because they start to poke your blood vessel. You know, right? Your body got the the place to poke. So for a better blood circulation, give 3 types of medicine using N in their respective usage. So we can look at here the purpose of modern medicine. So you can just say I got 3 types. So you can say maybe analgesic, okay, to relieve pain, not pain, especially like Panadol. Paracetamol is Panadol. Panadol is the brand, paracetamol is the chemical name. Antibiotic to kill bacteria and so on. Bacteria, I'm not saying virus. So you can say here the growth infectious bacteria. Let's say, I think if you put virus, probably it will be not correct. Psychotherapeutic, from the word psycho, mind, or psychology. You psycho. Psycho means the brain problem, right? Psycho, you scold people psycho. So you can see psycho, but therapeutic is medicine, psychotherapeutic. So maybe if the person 有忧郁症, giving depression, stress until maybe he's saying he want to die, so we give him antidepressant, maybe ibuprofen or amitriptyline, so that he won't feel so sad. Yeah, but doesn't mean it's not a good thing lah. If you eat means every time you need to eat, and if you don't eat then not good. We also got learn, if you eat too much also, you spoil your kidney also. So if you can, do not eat, go to exercise and so on. Okay, continue on. Give 3 times method. Method M is used together with the method N under a certain condition. So you want to use 2, M and N, depending on the situation. Justify M together with N in one appropriate. So when you want to use M and N, okay, so probably you can say when the person got cancer. Okay, when the person got cancer, you might want to use the modern medicine, like what is this called, radiotherapy, or what is the name, okay, radiotherapy, chemo, or doing chemo for cancer. Okay, so this is the modern medicine. And also you might want to use some method M to reduce the side effect. Okay, reduce side effect. Okay, so of course you want to say example, usually we use the word cancer, because if you are normal sick, probably a normal sick also can, like you got fever, so you might want to, let's say you want to take Panadol. At the same time, maybe you want to take some orange, because orange got vitamin C. It help to boost your body immune system. Maybe you can say like that also if you don't want to say cancer. But cancer is the more serious type. So you know when you get cancer, sometimes you use radiotherapy also you cannot survive. So maybe you want to add more medicine in order to help you. Okay, free radical causing health problem among individuals. Describe how free radical are formed.
Oxidation process that happen in the body.
Yeah, okay, free radical are formed from the oxidation process that happen in the body, okay, due to internal external factor. So just say lah, the keyword is it form oxidation. It has the cause the process of oxidation process, which actually it take the electron from the molecule or atom, causing the atom to be unstable. And again, by causing the atom or molecule to be unstable, it actually changed the DNA, causing mutation. State 2 factor of free radical. So what are the factor for free radical?
For external factor is like smoke from factories.
Okay, smoke from factory.
Cigarette smoke.
Okay, any more?
And internal factor is like inflammation.
Oh, yeah, okay. So of course the one that cause radical formation, factory, smoke, air pollution, cigarette, sunlight. But I don't know why the marking scheme didn't say food. So you don't just say lah, but I know it is. But I don't know why the textbook didn't say it's food, because maybe many type of food, so they didn't put it. But yeah, okay, just make it simple, factory, cigarette, but don't write food, because I don't know why the book didn't say, so I just follow. Or internal factor may be caused by metabolism and inflammation. Means your body got problem. For example, inflammation is like, I think it's like 肿 lah, 肿 like it bengkak, inflammation, or maybe something happen lah, inflammation. And inflammation from the skin you can see, let's say here got inflammation, you can see here red color, or here the thing come out, something come out. But when inflammation in the body is very difficult to see, you never know. In the lung, in the heart, in the muscle cell, so that it can cause inflammation, and you cannot see, so you need to go check up. Maybe you feel not comfortable, you feel pain, but maybe there is some internal inflammation. Explain why free radicals are not the problem for some individual but can cause health problems. So this one you need to think. Why free radicals are not problem for some individual but can cause health problem to others. Why? Yeah, because of their lifestyle and living environment. But you need to explain.
They eat and
Yeah, so you need to, I know it's lifestyle, but you need to make it into the sentence. Make it into a good sentence. Maybe you can say like, you need to make 2 points. There are 2 questions. If you read the question, explain why free radical not a problem for some people and problem for some other people. So probably when I give the answer, I will say point number 1, why some people no problem. Point number 2, why some people got problem. Probably it's lifestyle, because you say already it's lifestyle. Maybe the first person got young, stronger genetic, he got exercise, so he has lesser problem, health problem. For the second one, maybe he's a bit old, his genetic is weak or not good, and he always exposed to sunlight more than the one little bit, two is more, so maybe it cause problem for the second one. The first one is smart, he control, maybe he got control the exposure, and the number 2, so you just need to put it into the word. So let's try to answer, but should I write it down? Okay, so I try to write it down. Okay, maybe I just write to some people, okay, it will not cause health problem. I cannot see how many mark of this question. Let's say it's 4 mark, so maybe I need to write 2 point, 2 point. Right? To some people it will not cause health problem because he has a stronger genetic, his exposure to free radical is lesser as well. Then maybe I can say many things lah, okay. He also like to eat antioxidant food, which can prevent oxidation in the body, oxygen process in the body cell, for example. Okay, point number 2. However, another person might have health problem due to genetic, maybe due to genetic issue or weak genetic. Due to genetic as he might has more exposure to anything lah, cigarette smoke, air pollution, and he consume and he eat many char kway teow. No, I don't say char kway teow lah. Maybe he eat many char kway teow means also he eat many, or I cannot say food because the textbook didn't say. Never mind lah, then I just cancel this. He exposed to a lot of food, and he seldom eat orange. He seldom eat orange. Okay, but you don't say eat orange, okay? You say he seldom eat food, antioxidant food. Antioxidant food like orange and kiwi, for example. I think it's more than that already. I think I already write 5-6 mark already. So but you need to able to answer you need to read the question. Sometimes when you read you start to confuse. Don't need to be confused. First you just need to separate the question. Question 1, and then he is also asking question 2. Why some people die? Why some people don't die? So people die because he always eat char kway teow. People don't die because he always eat orange. But you don't say eat char kway teow and orange, okay? You just say use the keyword. The keyword is what? The keyword is free radical. The keyword is antioxidant. The keyword is free radical, cancer, genetic, maybe someone got what? something lah. Maybe some example also can give you mark. Example of food. So basically this is the keyword. Just make sure when you explain you just use this keyword. I think probably you will get full mark for it. But I cannot see the mark, so I don't know. If you see, you pandai lah. If you say 4 mark, probably here 2 mark, 2 mark. Okay, here already say 4 mark. If 2 mark, then you write lesser. 4 mark, 6 mark, you write more. So many more to go, but I think it's enough for this topic. I hope that you continue to study this topic. Not only just for science, go to YouTube, search more video about health. I think it's good for you to learn. Let's say if you have got fever or you got stomach ache, you got diarrhea, straight away Google. Okay, don't ask your mommy. Go Google diarrhea, go Google fever, go Google head pain, how to reduce. So from there you can learn by yourself and also will help in your science. So that's it for this video, and I hope to see you in the next video. See you again. Bye.